I'm Anna Olatunde. I'm the head of nursing unit. I coordinated nursing department during the outreach, and at the nursing unit, we're able to check people's BP for the adults. We check their weight, their height, and we're able to rule out malnourishment, underweight, and overweight. Also, we discovered that majority of these people are suffering from hypertension. And also from the nursing unit, after checking their height and weight, although because of time we could not check their BMI, but we were able to direct them, sort them out, direct them to where they need help. For example, from our station, we directed them to physiotherapy units or consultation table or to the laboratory, them or to the ophthalmologist, or better still to dental department, where they receive adequate care and they are attended to as needed. Another thing we did during the outreach is that we gave health education, a brief health education to people that needed a health education at that particular point. For example, we identified some children suffering from malnourishment, and we educated their parents on what to feed them with. So in advice, I want to advise the villagers to consider what they will eat and eat appropriate meal at each particular point in time. For example, if they want to eat, if they are going to eat a diet, it must be a balanced diet.
Hi, my name is Dr. Okitade Ifeoluwa. I'm a dentist, and what we generally do as dentists is we first of all do dental education to let people know about how to maintain their oral hygiene, how to the cheapest way to keep their teeth out of diseases. Also, we take care of dental diseases which could range from dental caries, periodontal problems, halitosis, and also I'm a maxillofacial surgeon in training, so that is we're able to see dental lesions that require surgical cases. We're also able to see cleft cases, and we also attend to that. Now we are here in Atisbo local government, Ofiki to be precise, where we are on a 2-day medical mission. And in this place, we saw a total of 40 patients in the dental unit. In the day 1, we attended to 4 patients. On the day 2, we attended to 36 patients. That was about an 81% increase over the previous day. For both days, we addressed everybody, the entire crowd of people that came, whether dental and non-dental, talked about their dental health, and we talked about sensitization and how to identify cleft lip and palate anomalies, of which we saw 2 cases of cleft lip in a 4-month-old male and another 4-month-old female. In the dental section, we saw a total of 40 cases. We had a ratio of 1.5 to 1 for male to female ratio. That is a higher percentage of males to the females. The most common diagnosis was localized chronic periodontitis, which presented with mobility of the tooth. That was about 15% of the cases, which was the majority. We also had cases of retained roots. We had cases of irreversible pulpitis. These were cases that warranted extraction of the teeth. So we did a total of 33 extractions. We did 6 scaling and polishing procedures. Scaling and polishing is warranted from patients who have a condition we call generalized chronic marginal gingivitis and staining. So we did 6 cases of scaling and polishing. There were 2 cases we had to refer because they were having tumors. They were having benign lesions in the orofacial region, and the resources we have couldn't make us engage in the surgery for those ones. And then finally we had a case of somebody who declined treatment because he said if the treatment was done, he thinks it wasn't going to look fine. So we all had a case of somebody who, because of his aesthetics, declined treatment. And in all, we had a very wonderful working time. We were a team of 3, 2 guys and a lady, and everyone worked harmoniously, and it has been a wonderful time. Thank you.
I am Adiboyi Bangui. a pharmacist by training, and I was the head of the pharmacy/consultation team for this particular project in Ofiki community. During the course of the outreach, we were able to attend to quite a number of children, about 250 children. We were able to do mass deworming for these children, and we attended to total population of nearing 500 people. And the community in particular has peculiar healthcare challenges that we were able to make efforts towards addressing, even though we could not address everything because of limited resources and all that. So we're able to do a lot of health education, talk about nutrition, healthy lifestyle, and then we're able to do dispense some drugs. We are able to treat some patients with presenting complaints of malaria. We were able to run some tests, diagnosis tests for malaria. We did blood pressure measurements, we did blood sugar, and we were able to do a couple of other things here and there too. And with respect to drugs provided, we were able to tackle mostly the infectious diseases, but we were able to look at how we could handle one or two other non-infectious diseases too. And one of the peculiarities that we found out in this community is that there is a large unmet need for the maternal and child health care. So that's been an area that we're able to kind of improvise to see how we could provide adequate education about antenatal care, how to space children, family planning and all that. So it's really something that we really didn't envisage while we're coming, but it's something that we met on ground and had to tackle. And then just in line with our objectives of CHEP, we understand the fact that healthcare in Africa is really something that needs a lot of resuscitation, but we need to make efforts towards it. So that's what we've been able to do here, and I think it's really, really amazing. It's a step in the right direction. Yeah.
I'm Dr. Clifford Dike, an optometrist and the head of the eye unit in Czech. So we are eye care professionals. We are basically into eye care. So we attend to patients in rural communities, in communities that do not have direct access to eye care. So like what we have done in this Ofiki town, so we've been able to attend to over 130 patients, so with different complaints of the eye. So we were able to dispense 88 pairs of reading glasses for presbyopic patients, those that were not able to read tiny things and those that were having difficulties in operating their phones. So with the pair of reading glasses, they could read effectively and they could press their phone very well, and these patients were very happy. And apart from that, we were also able to refer 26 cases of mature cataract for cataract extraction. We also saw 10 cases of glaucoma, and we referred to our secondary facility for expert management. And also we discovered in this place that for the children, especially for those below 18 years, we saw that cases of vena keratoconjunctivitis were very common in this town. And we also counseled the patient on how best to care for their eye. And generally we had a very successful outreach in this place, though we had some few challenges. These were areas of drugs. We have very limited drugs, and because of that we could not actually prescribe as we're supposed to be, because it's only few patients that were given drugs. So with good partnership and with enough fund, and the next outreach to be bigger than this, and I hope with support and effort, so we'll be able to achieve more. Thank you very much.
My name is Akiumi Eniola, and I headed the laboratory unit. A total number of 105 tests were conducted today, which are inclusive of RVS, hepatitis, random blood sugar, and urinalysis. For the urinalysis, the results were normal. For the RVS and hepatitis tests, they were conducted mostly on the surgical patients, and there was no positive results. For the random blood sugar, the tests conducted were okay, except for just 3 diabetic patients that were discovered. This outreach was indeed a success, and we thank God for it.
I'm Dr. Eluebo Victor, head for surgery unit for Czech outreach here in Ofiki land. It's been a great weekend, and God has helped us. We're able to performed a total of 13 procedures here, covering anatomy in children, lumps and hernias in adults of various sizes, including huge giant endoscrotal hernia and femoral hernia. All in all, it's been a beautiful outing. We thank God for the impact and the success of it all. There's been no complication. We are glad for the response and cooperation of team members and members of the community in a good time. Core concern is to increase scope and scale of these procedures, and I'm sure going forward things will get really better. Thank you.
Wow, it was a major outreach, and we're so excited to be part of transforming lives in Ofiki. And in just one mega outreach, we were able to attend to over 600 clients from our estimates. We had about 200 children that were dewormed. We also had about over 130 laboratory, almost 140 laboratory tests, blood and urine tests done. Also, at the surgical aspect, we had about 43 surgical procedures done in total, both general and dental surgeries. And interestingly, at this outreach, we had a physiotherapist that provided physiotherapy services to about 68 clients. And most important, and also importantly, about 88 clients received eyeglasses. We believe this was wonderful, and we trust God that to keep getting better and better for the people of Ofiki. Thank you very much for your support for this outreach. We appreciate all our partners in Nigeria and all over the world, and want to encourage you to help us to reach out to better communities. Remember, at Check, we create healthy communities. Thank you.